Hello, everyone. Welcome to the Healthy Joints Healthy Lifestyle Show. And I have my very dear friend, Dr. Celine Lee, who is a double boarded in rheumatology as well as dermatology, gracing us with her presence today. Hello, Dr. Celine Lee.
Hi, Dr. Dada.
Hi. So welcome everybody to the show. Those who don't know me, my name is Dr. Aminola Dada. I'm a rheumatologist and so is Dr. Lee. So I do help people with joint pain become pain-free and people with autoimmune diseases get their immune system back on track. So today is not about me, it is about listening to our very talented and double board certified Dr. Celine Lee. Dr. Celine Lee graduated from Korea University Medical School, and since then, she's won multiple awards and has had a long path through residency and fellowship. So, to make sure that we are doing her intro justice, Dr. Celine Lee, can you please introduce yourself to our audience?
Hi. Hi,
Hey.
Dr. Dada's audience. My name is Dr. Celine Lee. I'm a rheumatologist. As Dr. Dada briefly mentioned, I used to be originally a dermatologist back in South Korea, but I saw a lot of patients who had rheumatic skin diseases, which was my the most interesting subject for me. So I decided to study more rheumatology. So when I went to United States, I changed my specialty to rheumatology. To be able to do that, I had to do another internal medicine residency and rheumatology fellowship. So total 11 years of training after graduating from medical school, just a lot of schools. And now I'm practicing rheumatology in Utah, in Murray City. So very nice to see you all.
Very nice to see you. Thank you so much for coming. And you have a DPC practice, though.
Yes, direct care, yeah, direct specialty care clinic.
Yeah, and you know what? Her patients, Dr. Lee, her patients absolutely adore her. So if you're anywhere in Utah and you need a rheumatologist, I don't think you have a whole lot of, there's nothing to think about. Dr. Lee is your woman. And just to prove it to you, we're going to go through our interview today, and I have a bunch of interesting questions that were posted by our audience. So let's get right on it. So, Dr. Lee, can you tell us? We wanted to talk today about diet and lifestyle, and how we can affect inflammation. Like, what can we do for ourselves? And this is a real hot topic. And so, one of the questions was, can you tell us about your work as a physician specializing in rheumatology, dermatology, and in lifestyle medicine? And what inspired you to take this holistic approach?
Yes, actually, I started noticing about how the diet and lifestyle habits can influence the skin back in when I was a dermatologist. So I noticed that I saw a lot of acne patients, dermatitis patients back in the days, and a lot of those skin diseases were actually coming from the lifestyle habits that I noticed. For example, if I treat like acne patients, no matter how many acne treatment the patient do, if she have a lot of stress or eating a lot of greasy food, doesn't sleep very well, and those kind of lifestyle habits, it was very difficult to treat her acne. If she continue to do those habits. So I asked her, what kind of food do you usually eat? How regular it is, the stress levels, how she slept. So once I found out that her life, I'm not her, but she just walked me through what kind of things she was going through. And I kind of identify some things that could cause inflammation. So for example, okay, so I eat a lot of like pork, it's kind of greasy pork, with the odor of fat. Then maybe she can decrease the pork and maybe change to a fish, for example. And if she go to the sleep in the irregular time, so maybe you can set a time, go to the bed every time, and make sure that you get at least a 7 to 8 hours sleep. So I kind of asked her to let's do those things together. in addition to, all the nice things, the chemical peels or acne extraction or the topicals and whatnot. But let's do this together because previously using only medication did not get her to where she wanted to be. So she made those changes, and then we finally start to see improvement. And this is not just one patient. This was universal, that all these acne patients or some like allergy patient as well, if their lifestyle was not, you know, anti-inflammatory style, if they're putting a lot of inflammatory triggers into their lifestyle, then it's very difficult to treat these inflammatory conditions. So from there, I brought that to my internal medicine practice, and I saw a lot of those things applies to rheumatoid patients too, where I see a lot of rheumatoid arthritis patient flares with those triggers. So I started to focusing on those as well when I'm managing those rheumatoid patients.
Yeah, yeah. That makes so much sense, and I think that's something that people are becoming more aware of now is just the fact that the lifestyle and the nutrition is not just your skin, it's not just your joints, but it's your whole body and what are you putting into your mouth and and more importantly, I think there's a little bit of fear is if you say, hey, everything I'm doing in my lifestyle is bad for me, it's such a big delta. It's so much to ask for. But the way you worked with your patient is you were like, okay, we've identified fatty pork. How about we switch it to fish? I was
Mhm.
like, okay, that's easy. I can do that. She's not asking for the moon and the stars, and then you're like, okay, why don't we move your sleep? Why don't we move it from, 4 hours and stop the scrolling and let's move to 7 to 8? And having that in addition to everything else that she'd been doing made a dramatic difference. And you're so right how that translates across the field into patients with rheumatology. So that's actually and so I think with dermatology being so visual, it's like, wow, the person comes back a month later and you're like, wow, okay, this is a dramatic change. So yeah, I can see totally how that would just kind of be very striking and motivating for the
Mhm.
patient as well as the physician.
Yes, yes, yeah. And we can see in our, as a rheumatologist, we can see in the joints too. It's been probably not because skin is more, responsive to those changes and have a fast turnover than joints.
Yes.
So
Yeah.
we can see more faster and more visible because it's just skin.
Yeah.
But in our rheumatoid arthritis patient, we sometimes can see, and sometimes patients tell me, oh yeah, I did a little bit of too much of these sugary snacks, and then they come with this neuritis
Yeah.
over their
Yeah.
joints.
Yeah.
So some patients actually realize that, oh, I know which food triggers my inflammation, and sometimes they bring the list about what
Yes.
kind of food usually triggers inflammation
Yeah. Yeah.
in their joints.
Yeah. It's always helpful when the patient actually is able to identify and pay attention to those things. And
Mhm.
because that really helps kind of partnering with those patients on their route to wellness.
Yes.
Okay. So how do you think that diet impacts inflammation in autoimmune conditions like psoriasis, for instance, which is something kind of encompassing a little bit of skin because of psoriasis? And for
Mhm.
those who don't know, psoriasis can also be associated with an arthritis. So we're trying to cover, because Dr. Celine is also a dermatologist, we're going to see if we can get two for one here.
Yes. Yeah, so psoriasis actually, not a skin disorder, it's a systemic disorder that happen to have the primary manifestation on the skin, but it can, as Dr. Dada knows, we see a lot of psoriatic arthritis patients. So psoriasis can appear mostly on the skin, but also the joints, the tendons, spine, and even the eyes. So it is a systemic disorder. And I think, the skin, joints, and gut, those three organs are very tightly related. And we sometimes see patients who have psoriasis have some gut problem as well. And probably, that could be the reason why those diseases, the psoriatic arthritis and inflammatory bowel disease are also related under this HLA-B27 gene mutation. Because when somebody has this genetic tendency of autoimmune disorder, it's
Yeah.
not just one organ that will be affected by that. It's the skin, which is the psoriasis, the gut, the inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, and the spondyloarthritis, which is the joints and the tendons and spine. So they're all related. So
Yeah.
gut is the input. So how I understand it is gut is the input of where our immune system is exposed to those triggers, and the
Yeah.
skin and joints are where those effect is manifested
Yeah.
to the organs, the joints and the skin. We are not absorbing, I mean, skin, yes, we are exposed to the triggers, but joints, we are not absorbing things to the joints, but joint is the easy target for the immune system. So
Okay.
some patients actually feel the certain food. This one, I think that eczema or the acne are more sensitive than psoriasis, but some people definitely feel that certain food make the psoriasis more symptomatic. It could be more lesions, it could be more itchiness, things like that with certain food. So for example, if they eat a lot of like processed food, such as like bacon or sausages or McDonald's, any of those processed food, they have a lot of sugar, then they'll see that their lesions just get worse. And if they change the anti-inflammatory diet, such as more plant-based diet, whole food, omega-3 rich foods such as fatty fish or flaxseed, and plenty of water to make sure they good hydration and good sleep. Those anti-inflammatory lifestyle, they can see those rashes gets better and more not non-inflammatory. So the lesions could be still there, but they are more less erythematous and less like angry looking
Yeah.
because the inflammation goes down. So
Yeah.
whatever input we are putting into our gut
Yeah.
will show in our skin and the joints because there's
Yeah.
input in the belly and the
Yeah.
output in the skin and the joints.
Yeah.
And in fact, about 70% of all our immune cells are housed in our gut.
Yes.
70%,
Yes.
because that's the longest surface that our body meets with external triggers. The skin is also very large, but when you think about those kind of put our gut out and really, really spread it out with all the villi and all spread it and actually measure the surface, how much of surface that we have in our gut.
Yeah.
It's that's the largest area there.
Organ. Yeah.
Yeah, where
Yeah.
we need external triggers. So
Yeah.
it makes sense that 70% of immune cells are housed in the gut system. And
Yeah.
whatever we put it there, our immune system will respond.
Yeah.
So,
Yeah.
so it's a
Yeah.
input and output.
Yeah.
Crap goes in,
Yeah.
crap comes out, good things go in, good things come out.
Yeah. Yeah, so yeah, I think sometimes we forget because, with the colon and everything kind of folded into the villi, the colon is so folded. Some of our guests may not actually even, our audience may not even realize it. But if you took it and you stretched it out, then that may end up being the largest organ. And, right in that area, we have a lot of lymphoid particles and organs, which actually is important for your immune system, which is why it totally makes sense what Dr. Lee has said is that, anytime you're putting food, depending on what kind of food, it can be helpful, it can be healthful or not, and can trigger the immune system. But while we're thinking about this, Dr. Lee, and that important point you made, my question is that how do we kind of impact the gut microbiomes? I mean, you've told us some of the things that we should not be eating, right? So, I mean,
Mhm.
definitely I heard the word sugar a couple of
Uh-huh.
times
Uh-huh.
as something that we should avoid. But how can we affect the gut microbiomes?
So the microbiome, they are the organism that living with us. So we have like symbiosis relationship that since birth. So we are exposed to the microbiome for the first time by meeting our mother's vaginal microbiome. So that's the first microbiome we'll encounter through the food that we eat. So the first time when we are being born, usually by vaginal delivery, that will be exposed to our mother's vaginal microbiome. And since then, we'll be exposed to most microbiome mostly by eating food. So the more diverse and more healthier population we have in microbiome, the better for our immune system, immune regulation, and also some other metabolic effects can be also achieved, such as cholesterol regulation, things like that. And those microbiome are they're living organisms, so they need to eat. And what do they eat? So they eat fibers. So the fiber is the most deficient nutrient and most forgotten nutrient in American diet than anything else. So the fiber-rich food is known to decrease cancer risk in patients, and also fiber-rich food can decrease cholesterol level. So when we eat fiber, fiber cannot be digested in our own GI system. So it'll go all the way down to the colon area and non-digested because humans cannot digest fiber, but microbiome can. So microbiome will digest the fiber and they will do their things, and some of the molecules they will produce with their metabolism will help our body to regulate the immune system and decrease cholesterol, things like that. So to nurture them, to make sure that they thrive, we need to give them enough food by eating a lot of fibers. So fiber-rich food is really important. And also, because those microbiome are usually ingested, we can actually ingest those microbiomes. Good source will be fermented food, such as kimchi, yogurt, kombucha, those kind of fermented food, and sauerkraut as well. And those fermented food have naturally, occurring healthy microbiome, so we can basically ingest them. Then they can go to our GI system and they can live there helping us. So one of the reasons why this like healthy food, when we get this healthy food award, we see a lot of the fermented foods such as kimchi, yogurt, or nattos. They're all fermented food. So it's a good idea to eat at least some of the fermented food every day, so we can keep the healthy population of microbiome. Another one is if we can avoid, it's good to avoid antibiotics. So if we need it, we need to take it. If we have a bacterial infection, if we have like bacterial pneumonia, then we have to take it, because otherwise it can be very dangerous. But if something like just a mild viral common cold, I know that some people want to take antibiotics for those kind of viral, sinusitis or just viral common cold. But usually it doesn't work anyway because virus doesn't get killed by antibiotics. Those are antibacterial, not antiviral. And so it is better just to let our immune system fight with them and just get it, recover by itself instead of taking antibiotics. Because whenever we take antibiotics, it can really disrupt the microbiome system, and it may take longer time to restore those microbiome. So I would recommend not to take too many antibiotics unless you have some reason to, so such as if the bacterial infection and you're immunocompromised because you're taking some immunologic medication for rheumatoid condition, then you need to take antibiotics. Otherwise, you can avoid it to keep the microbiome healthy.
Okay. Wow, there's a lot to unpack there. Sorry, I just wanted to kind of use that as an opportunity because a lot of people would want to go to their doctor with some upper respiratory tract infections, usually viral, and feel very upset when they leave their primary care doctor and all they got was some saline and prescription for saline rinses, right? Because the doctor did not feel that they had developed any infections at that time. And so understanding that there's a risk, not just a risk for antibiotic resistance, but also that you're destroying your gut microbiomes when you take antibiotics, especially when they're unnecessary, right? If they're necessary, then there's no option. But while we're at it though, so let's say you do get an antibiotic and you have sinusitis, you don't have a choice. You have to take this thing antibiotic for 14 days. And usually you're taking a pretty potent antibiotic for that. So is there there a way to replenish is it the same way? Is there a way to replenish, like purposefully replenish your gut microbiomes after that has happened?
Yeah, so I think after the antibiotic is finished, and if your gut is okay, because some infection can also mess up with the gut. So we need to make sure that the gut is healed, and then we can do a little bit more, a little bit more fiber food, and also we can increase the dose of those fermented food. But I think it's okay to take some supplement that contains like a probiotics. So
Okay.
I'm not too against about taking probiotic supplement because
Yeah.
sometimes it's difficult to get all the microbiome, the good microbiome just through the food. So some good quality probiotics that can go all the way to the gut because it's not like everything will go there. Some will be destroyed in the stomach and in the upper GI area before it got to the
Yeah.
colon. So it's not like we can absorb a lot of it and it'll become a problem. But I usually recommend to start with the slow, low the CFU and then increase the dose gradually,
Okay.
especially after antibiotics because
Yeah.
we need to kind of re-inoculate some of
Hmm.
those good microbiome, especially right after killing them. By
Yeah,
antibiotics,
yeah.
yeah.
So it sounds like one needs to be more proactive. Like, so you're taking the antibiotics, as per your doctor's orders. You've been a good patient. Now your gut's rested. So it's not just eating at this point. Now we have almost like we have more work to do because now we've just cleaned out the gut. So that may be a time for, in addition to the high fiber diet, in addition to kind of eating the fermented foods, is also kind of looking at a good probiotics. And because the stomach, for some people that may not know, is acidic, if you some of the probiotics, not all of that will actually reach the colon, which is at the very end of the track of the gastrointestinal tract. So kind of making sure that one, you don't overdo it, but also that you're taking the good quality probiotics that would actually be helpful to you and not just, wasting precious money, I guess, on probiotics that may not be effective. So making sure that you get the right advice makes
Mhm.
sense. Okay. So we've talked about kind of the gut microbiome and antibiotics and the effect and even if you're not sick, even making sure you're eating food that's rich in fiber. How about other than diet? You kind of mentioned when you were talking about, one of the reasons why you kind of started looking at things more holistically when you were a dermatologist. But other than sleep, for instance, are there other lifestyle habits? Or what other lifestyle habits would you recommend that people really pay attention to that can be these little bite-sized pieces that we can ingest and do that 1% atomic habit changes to make sure that we are eventually at the end of 365 days that we've noticed a significant improvement in
Yeah,
our
I
immune
think
system.
definitely after the diet, definitely sleep. The sleep
Okay.
is to the point that people can survive without eating food for many, many days, as
Hmm.
long as they drink water. But if they don't sleep, they actually will die earlier with the
Yeah.
sleep deprivation than food deprivation.
Yeah.
So sleep is essential. It's an essential life function. And without it, we really cannot function and we will eventually die. If we cannot sleep, then
Hmm.
we'll die, basically. That's how
Hmm.
important it is.
Mm.
But because of these busy modern days and we have lights, now, so we can be awake as long as we like. And sometimes we just get carried away by work or study or sometimes, the social media and our sleep schedule get disrupted quite often these days. And it's become a more problem in younger people as well because especially teenagers where they need to grow up, if they don't sleep very well, they cannot grow up. So if you want to become taller, you need to sleep. Um,
Yeah.
yeah, so sleep is really important because sleep is where our body does its own maintenance. So
Yes.
all the inflammation and toxins and injuries that we accumulate in the waking times, if we don't go to sleep and become actually unconscious in our conscious mind and completely go to the repair mode, unless that happens, our body cannot repair itself. So,
Yeah.
if somebody have a little minor injury or a little cut in the skin,
Yeah.
and didn't put any like ointment or whatever, but they just have a really good night's sleep. The next morning you wake up, you will see that cut is already healed a little bit, and
Yeah.
all the inflammation of the area will
The
be
healing
already
power of
better
sleep.
just by sleeping.
Okay.
That's
Well,
how important it is.
yeah.
So the diet and sleep and obviously the exercise because we cannot if you eat really well and sleep really well, but you're just sitting on the couch like all day, every day, and you're not moving around, and then your muscle will get atrophy. And when your muscle get atrophy, then your metabolism will go down, and your joint cannot get support, and your joints will get degenerate even faster. So movement is also important too. And as we saw that in the COVID studies, that people who had exercised regularly had a lower mortality rate when they got
A lower what rate? I'm sorry?
mortality rate.
Mortality rate.
Yeah,
Okay.
so the patient who have a regular exercise, they
Yeah.
die less from
You're
COVID.
less likely to die. If you
They're less
exercise more,
likely
you're
to
less likely to die.
exactly, yes. And also the lifestyle medicine studies show that the breast cancer survivor, if they exercise regularly, their long-term survival was longer
Yeah.
than people who did not exercise.
Size.
So
Yeah.
exercise is not just mechanical. There's a lot of physiologic changes come with exercising because our body is meant to move. So by moving the muscles, we are actually moving the heart and the lung because
Mm.
they need to
Yeah.
also pump
Yeah.
faster, breathe deeper, and the circulation and all the cytokine that will help the physiologic changes of exercise. All of this will help us to thrive in our life. It's not just mechanical, it's not just
Mhm.
physics, it's actually
Yeah.
physiology
Physiology.
changes that
Yeah.
we
Wow.
really need.
Yeah.
Yeah.
Well, you actually made two very important points. When you were mentioning sleep and kind of contracting it rather with exercise. You said that because we have light. And the beauty and the wonderful magic that light has created for us. With
Uh,
light, with light, then we can do things at night when we're supposed to be sleeping, right? Because what are you going to do when you don't have light, right? Yeah, now we have light, we have our phones, we can be scrolling in the middle of the night, interrupting the sleep cycle, right? And you made this important point. I think if you take it to that extreme, if you don't sleep, you'll die faster than if you didn't eat.
yeah.
I have not thought about that,
Yes.
right?
Yeah. Lose your sleep, you lose your lifespan.
Lose your life. So you think
Yeah.
about small doses, like small doses of poison if you don't sleep. And then the
Exactly.
other thing is now that we have cars, we have sedentary jobs. If we were doing what we used to do, hunter-gatherer, there is no
Mhm.
light. And when you wake up, you go hunt.
Yes. Yes.
You couldn't
Yes.
be
That's the
sedentary,
life.
right? We were built to move,
Uh-huh.
right? We're
Yeah.
built to move. We're not built to be sedentary.
Yes.
And kind
Yes.
of, like, and what you're saying is it's not the physical movement, it's the physiological benefits. And the fact that even people with malignancies can extend their lives. And
Mhm.
breast cancer survivors can extend their lives by exercising. And so it's
Mhm.
not just the fact that you're moving, it's just the physiologic benefits. Can I ask a question then? Because people are going to say, well, how much exercise?
So I would say, if you have never exercised before,
Yeah.
you can go slowly. Maybe you
Yeah.
can target like, okay, I'll do just twice a week, and you can
Yes.
just start, twice a week, and then okay, so I can do it now, so we can go to 3 times a week, and ideally, it'll be better to do every day some movement, some activities purposefully for about
Yes.
30 minutes every day
Yes.
And when you exercise, it's always a good idea to mix some cardio and some the muscle strengthening exercise
Yes.
because we need both.
Yes.
So for cardio, make sure that you can increase the heart rate. There's so many gadgets these days, Fitbits, Oura rings, whatnot. So actually, I think a good idea to have some trackers because it gives you the visuals so that you
Yeah.
know that where you are. So if you're kind of doing the treadmills and your heart rate is like 70, so maybe it's it's not enough. So maybe you need
Yeah.
to
You
speed
walk a
up.
little faster.
Exactly.
Yeah.
So your heart rate
Yeah.
can go up. And you should really break out some sweat so you can
Yeah.
talk but cannot sing. So you can
Yes.
just somebody talk to you, you can just, oh yeah, oh yeah, yeah, Lord. And you can
But you
talk in
cannot
the
sing.
short words, but you cannot really say the whole
Sing.
sentence without,
Okay.
the panting.
Buzzing.
So
I
that's
love that. So you should be exercising enough to where the intensity, if you're not measuring it,
mhm.
should be where you can talk, but you cannot sing. That's actually pretty good. That's a good one, Dr. Celine Lee. But the other thing also is, one of those things that we learned is what gets measured gets
What
improved. What's get
exactly what we
measured, right?
very
What
improve.
gets measured gets improved. So
Yeah.
that's the idea. I've been thinking about getting one of those trackers myself
Mhm.
because I think sometimes it's at the end of a day and you're like, oh, I'd like to take X number of steps. And you're like, oh, I only have like 100 more steps. I can do that right here. I can get up, walk around the garden or whatever. Boom, 100 is done. But if you didn't track it, if you didn't measure it, then how do you
Mhm.
improve it, right? So what gets measured gets improved.
100%,
Yeah.
100%.
Okay, that's very helpful. I love that, idea of, just kind of going through, the sleeping and the exercise and just kind of going back to the fundamentals,
Mhm.
right? Okay. So there is a lot of buzz about the anti-inflammatory diets, the Mediterranean diets, the plant-based eating. We've talked about it a little bit. Do this actually work on reducing symptoms? And how can people, because I had a patient and I was telling him about the Mediterranean diet and he said, forever?
Mediterranean diet?
Okay, yeah, he said forever. Does that mean, does that, yeah, do I have to do this diet forever or can I do it for 6 months and call it good? Right? He wants to know the end date so he can go back to whatever he was doing before.
Oh.
Please help us here.
Oh, well, we are living life forever, right? So we live our life forever until we die. And to live, we need to eat forever. So whatever we eat, it's like a fuel. So food is fuel. Imagine that your body is a Ferrari.
Mm.
You don't want to put a crappy fuel to your Ferrari, right?
No, you don't want, no,
Uh,
you don't want to put kerosene in there. No, it has to be
exactly.
like, the
Yeah,
high octane level.
exactly, yeah. So when we eat, we will burn, we'll move our body, we'll do our physiology, and then, hopefully it will come out as a poop. So it's a fuel. So if you think
Food is
that,
full.
oh yeah, I have this Ferrari, I'll just give a really high octane, really high quality gas for 3 months, and then after that, I'll just put really crappy, gasoline with some like you know, contaminants in my Ferrari and see how my Ferrari does after that. You know.
Good analogy. I may have to keep that. When next time he comes in, I'm gonna be like, yeah. Do you have a Ferrari? Yeah, if you had a Ferrari, would you do that? They said, what's more important, you or your Ferrari? You're like, yeah. So it's if you eat forever, okay. Like, I
Yeah,
felt sad
exactly.
responding to it. I just said, yes, it's forever. But I like that you said you eat forever. Like food
Mhm.
is full,
Mhm.
right? And if your
So
body is precious, and our
yeah, so I
bodies are
think
precious,
people feel like I think people feel too restrictive, and
yeah, they're being
I'm not saying
deprived.
that you need to eat Mediterranean diet every day, and not in a single day you cannot, it's not like that. If you, I would say, 1 week, if you can eat right thing for about 5 to 6 days,
Yeah.
and you have one days that you ate
Cheat
something,
day.
the cheat day. I think
Yeah.
that's okay because
Yeah. Yeah.
we need to eat some food that is, we can enjoy and some the
Yes.
food that we enjoy.
Yeah.
Could be not, it could be cake. Cake
Yeah.
is refined sugar,
Mm.
refined flours, and a
Mm.
lot of oil going in. But it's, we like to eat cake, right? So, but we don't eat cake every day. If we
Let's hope
eat
not.
cake every
Yeah.
day, we'll likely develop diabetes.
Yeah.
So you can eat cake, once in a while, but majority of time, as long as your baseline, as majority of your
Yeah.
baseline is healthy, then your body will be healthy enough that you can take some toxins. So, but you can take care of that. But if you
Yeah.
do majority of the days like toxic food, and then once a week you eat healthy food, there's no way that one dose of healthy food can clear those
Yeah.
toxins out.
Yeah.
It should be the other way around.
Yeah. The other thing that I told, is exactly what you're saying, right? Is to kind of think long term and say, hey, let's start making tiny changes. One of the things that you had said, Dr. Lee, was, switching out the pork for the fish, right? That's not a massive change. We haven't touched anything else you're doing. We're just making this slight change. And very interesting, when you've been away from sugar for a while, you will find out that your taste buds, which are previously addicted to the sugar, actually acclimatize to no
Mm-hmm,
sugar. And
mm-hmm,
it's like within a week, you will find
mm-hmm.
that if you taste, you're like, oh, wow, that thing is too sweet,
Uh-huh.
right? So,
Yeah.
it's not like it's going to be ongoing deprivation and you're going to continuously feel like you're being deprived. Your
Mm-hmm,
taste buds even acclimatize to not really having that sweet sugar, as they
mm-hmm,
start to appreciate other foods in the
mm-hmm.
Mediterranean diet. So most people that are actually on a more strict Mediterranean diet are really not feeling like they're being deprived because their taste buds have started to acclimatize to not
Mm-hmm.
being in that high sugar environment. So I think
Exactly.
that's something that our patients need to know is, yeah, I mean, we definitely want to fuel the car with the best high octane fuel, but we
Mm-hmm,
also know that after a while, that body gets used to and
mm-hmm,
doesn't really crave
mm-hmm,
the high sugar thing. So it's actually the initial kind of getting off the sugar high,
mm-hmm.
that's a little difficult, but every day after that it becomes easier and easier. And we believe, I think Dr. Lee and I also believe in gradual. So we're not just going to come here. Dr. Lee has not said, hey, cut it out tomorrow. We said we're going to gradually make those atomic habits until they stick.
Mm-hmm.
And so it's not like, oh, you cut everything out, because I would say, Dr. Lee, in your experience, have you had people that just totally went off their favorite foods and everything? And
Yeah,
how does that work?
yeah, totally, totally. I have many, many, many patients who had very like severe like a chronic fatigue and the joint pain, muscle pain, low energy, cannot lose weight, all those problems. I had several patients who solved all the problems with diet change. Those patients that I'm referring right now are not the ones who had rheumatoid disorders, but they just had very not optimal body functions. If one thing I want to point out is if you do have true rheumatologic disorder, you need to take the real medication. So I'm not saying that those like a true rheumatoid arthritis that erode your bone can be treated by food. I'm not saying that. But people who have this more anti-inflammatory lifestyle, they tend to get remission faster, and also they tend to require less medication.
Yeah.
Obviously, there are some patients who genetically have this refractory disease, but majority time, average RA patients, if they are not sleeping, they're eating a lot of processed food, and they drink a lot of alcohol, most patients will require more medication because it's the inflammation is triggered by those food, so it will just require more medication. But
Yeah.
if those inflammation are not triggered by these lifestyle habits, then those patients can take less medication and still achieve remission. So
Yeah. Yeah.
it's really important that how how we really smartly and intelligently incorporate this anti-inflammatory lifestyle in conjunction with the medication, because that will really change how you treat your rheumatoid disorder. But for people who have not full-blown rheumatoid disorder, but have a really low body function, like chronic fatigue syndrome is one of them.
I'm
Um,
sorry, what did you say? Sorry, I missed what you said.
Chronic fatigue syndrome.
Oh, chronic fatigue syndrome.
Yes,
Yes.
chronic fatigue syndrome. Obviously, we need to rule out all other possibilities, such as like hypothyroidism or anemia or vitamin D deficiency. Those need to be ruled out. But also, we need to look at what kind of fuel is going into this Ferrari, right? So
Yeah.
because sometimes it's the really crappy fuel mess up all the metabolism, so make the body cannot produce energy, and they can cause
Yes.
chronic fatigue. So I have some patients who completely change their life by eating the right fuel for their body, make
Yes.
sure that their body is being moved so those energy can be used, and make sure
Yes.
that their muscle get stronger and the muscle become, they increase their lean muscle mass. And suddenly they start losing weight like crazy. Their energy level goes up, they sleep better. So a little bit of this initial the momentum, once
In
you
that
get
share.
over that momentum,
Yeah.
everything just falls into place
Yeah.
naturally.
Yes.
And at that point, as you said, it's not just appetite problem. When they are on this like a really healthy diet for at least about like 3 weeks, and then they
Mm-hmm.
suddenly eat like really crappy food, like they
Yeah.
just went to some
Mm.
McDonald's and had some like Big Mac.
Yeah.
Their body can feel it's not just
Yeah.
a taste problem. Their body
Yeah.
feels so crappy.
Feel like, yeah. Yeah.
Yeah, they also feel so
Yeah.
lethargic.
Yeah.
They have bloating in their
Yeah.
in your stomach. They just
Yeah.
feel so tired. They want to take a
Yeah.
nap. So
Yeah.
that really kind of makes people realize that, oh my God, my body tells me this is not good for me.
Yes.
And once they experience that, that just appetite just to the Big Mac just goes away.
Yeah,
And
I would agree. Exactly. I actually have experienced exactly what you did a long, long time ago when I didn't know any better. I would have this road trip through Pennsylvania because my best friend and my mom lived on opposite ends. So I'd go on this 5, 6 hour trip, drive with the girls in the car, and it was something that I looked forward to. Other than, visiting the people, that was my burger. And I would be like, I was going to stop and I was going to stop at a fast food joint and I was going to get my burger. And that's the one time in the year when I would do that.
mhm,
And I don't know how many years ago it was last that I did it. And I felt so bad
mhm,
after eating it. All the greasy something, licked my fingers, and then I'm like, ooh,
yeah.
wow. And that's just my body saying, hey, we don't even know what you just ingested here. But whatever it is, we're rejecting it right now.
Uh-huh.
Right? So it totally, something that I'd been looking forward to all year. I was like, oh, that's my treat, that's my treat.
Mhm.
And that was the last time I ate it.
Mm.
I was just like, okay, I don't really, the greasiness, the everything,
Yes.
from where something intellectually I'd been looking forward to, yeah, I can't wait for our road trip. And then, I have it. And then my body was just like, hey, we no longer eat this kind of food. So,
Mhm.
you can stop it right now. So just to reiterate that your body just kind of gets used to not eating those, pro-inflammatory foods,
Uh-huh.
right? And that it's not going to be where it's a lifelong struggle. You keep, you're craving, you're suppressing, you're craving. No, after a while, your body just gets used to the higher octane petroleum.
Exactly. That's
So,
exactly right.
uh, question for you, my fave question, is tell us a story about a patient. I know you did one already. Tell us a story about a patient who you had dramatic results after being under your care.
So the patient that I talked about before, she had chronic fatigue syndrome, but not a true like a rheumatoid disorder. But I have one patient who had true seropositive erosive rheumatoid arthritis, very refractory type. So she tried many different medications, but she would just still have the synovitis. So synovitis is the joint inflammation, and
Yes.
she has the swollen joints. The ultrasound showed a lot of like a signal of inflammation in her joints. It was very difficult for her to treat her disease. And I kind of knew where that because I was asking about, I was trying to identify what are triggering this inflammation. She's taking, multiple medication, but what's fueling that inflammation? And I found out that she was working in a very stressful job
Oh,
where she could not eat regularly, so she had to just eat whatever she could
could
get her hands
find.
on, and those are usually processed food
Yeah.
that who knows when it was made, who knows
Wow.
what's in it. So, but because of her job was so stressful, she has this habit of eating processed food every day as
Yeah.
her lunch.
Yeah.
And she was under a lot of like this stress, she was showered by this cortisol stress hormone, and she worry about her work and she cannot sleep.
Wow.
So, but it was kind of difficult for her to stop the job at that time. But the world kind of did it for her because COVID happened. So COVID happened. So as like other people, so a lot of people did this great resignation around that time
Yeah.
and changed their job. So she kind of did that too. So
Yeah.
she quit the job. So she just kind of stayed at home for about 2 or 3 months. And during that 2 or 3 months, she really focused on eating the whole food. She cooked herself, make sure that she don't put too much of sugar, mostly
Yes.
plant-based. But she did some lean chicken and some fish.
Yes.
And she makes sure that she go to bed like 9 p.m. every day.
Wow.
So she made this change because I was always telling her, your job is too stressful. Can you kind of make some changes? Can you make some lunches? But it was difficult she did not have time to make lunch and
Yes.
bring to work. But now, so I saw her like that for the last time, and then she quit her job. She made this change for about 2 or 3 months, and then she came to follow up. I was
Okay.
amazed and I was thinking, oh my God, you actually have the bone. I can see the
Oh,
bones
you
of your
can see the
knuckles.
joints.
I
You
could
can
not see
see the
these knuckles
joints.
for a long time because they're all
Wow.
covered by synovitis, but I could see her knuckles now.
Oh, wow.
Yeah, and I did not change any medication. She was taking the same medication as
Yeah.
before, but it was purely her lifestyle change.
And
And
how long do you think it took to be able to see that? Because we talked about the fact that for patients with arthritis, it takes a little longer than something with skin.
yes, but for her, it just took about 2 or 3 months.
Oh, 2 to 3 months. That's pretty
Mhm.
amazing.
Yes,
But she
yes.
was already on treatment. This is something that just kind of took her to the next level in terms of improvement.
Exactly, exactly. Yeah.
Okay.
So,
Fantastic.
our food and our lifestyle either fuel our body to make more energy and make us
Yeah.
thrive, or it could fuel inflammation. So
No,
we can
we don't want to
fuel
fuel inflammation. We don't want to do that.
exactly, exactly. And yeah,
Wow.
it was amazing that I never seen her knuckle bones because it's always bulgy and always swollen, but
Okay, you could never see her knuckles. Okay,
yeah,
because her
because it
knuckles were
was
all
so
pretty
yeah,
inflamed.
they
Like
were so it was like so swollen before,
like
but
somebody put little
yeah, the
donuts in
bone
there.
contour was
Yeah.
so you can like this, bone contour.
Yeah.
I couldn't
Yeah.
see it before, so yeah, I was so amazed that
Wow.
actually I always talk about it, and patients tell me always, and I can see it myself too. But I still remember her case because she came from really refractory RA to
Wow.
pretty well controlled RA,
Yeah.
just by doing the changing the lifestyle,
Yeah.
obviously with the conjunction with
Mm.
medication. So
And so the well-controlled IRA is well-controlled rheumatoid arthritis.
yes,
Yeah.
yes.
Okay. Good. So Dr. Lee, if you had one superpower, what would it be?
Yeah, so you told me that you asked this question as the last question, so I was thinking about it. If I have a superpower, I I want to fly and be able to breathe while I'm flying and maybe not frozen to death. Because I like travel, and my family lives in South Korea, so I
Yeah.
want to go there as many as time as I can.
Yes.
Um, but I mean, airplane tickets are expensive these days, unfortunately. And I just want to go whenever I want to.
Want to, yes.
Family,
Yeah.
I like travel, so
Yes.
I like travel in the really remote areas, like in the
Mm-hmm.
desert in Utah. Utah have no
Yes.
shade of those places.
Yes.
I do scuba diving, so I want to just fly in the middle of the ocean and just kind of go there.
You
If
don't
I
want to wait. You want it now.
yes, if I have a superpower, I want to fly.
You want to fly. I love it.
Um,
Love it, love it, love it. Well, Dr. Celine Lee, thank you so much for this amazing time, really delving into, the gut microbiomes, how diet affects inflammation, how small changes that we make can impact our well-being, the importance of sleep, of reducing stress and of exercise. And
mhm,
remembering that sleep is, we take that for granted so much, but of the three, if you don't sleep, you die. Right? That's something that we haven't really thought about much. I think we all think if you don't eat, you die. But no, you can last quite a while and not eating. But if you don't sleep,
mhm,
then you die. So, one of the things that, I love your approach to kind of looking at the holistic medicine, just looking at the whole patient. And one of the things that you mentioned is, hey, there's some people that we can use a holistic approach for, right? And where we are looking at, hey, depending on your severity, it's not a one size fits all, and people should talk to their physicians, rheumatologists, and say, hey, in addition, do I need to be on medications? If I do, then a combination of kind of looking at your diet and medication will probably result in the best outcomes.
exactly, exactly.
Well, thank you so much for your time, Dr. Lee. But before I let you go, how can people find you? Because lots of people would want to talk to you.
So I practice in Murray, in Utah. So any Utah patient can find me. Also, I have Idaho license, so some patient in Idaho also come to see me.
Okay, Idaho and Utah. Okay.
And our clinic's website is lotusrheumatology.com, like a flower lotus,
Okay.
and rheumatology.com. And you can see information about our clinic in the website. Also, there's a link to the YouTube channel and the Facebook, so you can get some more information there too.
Okay. So on the Facebook, it's Lotus Rheumatology and Wellness Clinic. And so we are going to have the link at the bottom of this YouTube video. If you think anybody will benefit from listening to this, please share it, like it, subscribe to the channel. And thank you so much, Dr. Celine Lee. Find her if you're in Utah, Idaho. You can find her. She has licenses in both states. And thank you, everybody, for listening. Have a wonderful evening, Dr. Lee. Thank you so much.
Have a good night. Bye bye.